sadly, the pandemic has been bad for another crisis. The opioid overdoses and deaths are sharply up in Wisconsin and across the country.
Dr. Michael Miller from the UW School of Medicine and Public Health joins us now. We appreciate you being with us, Dr. Miller. Have a lot of people stopped getting help or treatment because of the pandemic?
Actually, early on they did, but we've had so much of an expansion of telehealth services, including group therapy by telehealth, and 12-step meetings, AA and NA, by platforms like that, that people do really have good access to care and should feel like they can get help.
So what do you attribute the increase to? Is it that the drug is stronger that they're finding now out on the street?
Well, the opioid epidemic has evolved over 20 years, from pills to heroin to synthetics like fentanyl and then fentanyl analogs, and brand new molecules like the stuff they call ISO that's been confirmed in the Milwaukee region. So people are using opioids that are much more potent, and the gap between the dose that gets you high and the dose that gets you dead is very small. So that's where the mortality is coming from.
Doctor, we have seen social isolation affect people in a lot of different ways. Can you speak to what is needed to curtail the problem of addiction during this pandemic? Because I imagine it only just hurts those who really do have a serious problem.
Yes, indeed. What we did early on is try to change the language a bit, because people in early recovery don't need social distancing, they need social connection. So for the pandemic, physical distancing with social connection, and that's what people should have. Definitely keep your 6 feet or more, depending on the situation you're in, but be connected through whatever means you can, including social media and being in touch with sources of support, family, friends, other recovering people, AA sponsors, therapists. It is possible to stay socially connected while physically distant.
Dr. Miller, there is, as you know, a tough time here for many people who have lost their jobs, income is down. Is help available for those who have limited resources?
Through county funded systems, they certainly could have more funding and more availability, and there are wait lists, but we're a lot better than some states with our social safety net and the medical services and human services we have in this state. So I would encourage people to reach out. And of course, the peer support, such as NA and AA, are no cost at all. And recovery coaches are supported through grants, certainly in Dane County where I work. And so recovery coaches are a great option. So people shouldn't be too pessimistic, but all your questions have been spot on. Social isolation is really tough. The stress of COVID has fallen to everybody, but folks with diminished coping skills and who tend to turn to drugs or alcohol as their coping instead of healthier coping have really been at risk. And the mortality from opioids went up 10% between December 18 and December 19 in Wisconsin, which was opposite the rest of the country, which saw some decreases. With mortality, looks like it's been up 40% year to year in the first half of 2020, going along with the pandemic.
That is stunning.
Yeah, troubling numbers. Dr. Miller, we appreciate you being with us, UW School of Medicine and Public Health. Thank you very much.
Thanks for having me.